and start the recording. So I think just to make sure I'm able to get through everything, I would appreciate it if you just popped the questions that you had for each section in the chat, and then I'll do my best to recap all of them at the end. And I'll get through as many as I possibly can, and any that I'm not able to get to, I will be sure to follow up with you or include that information in the follow-up email. So looks like we've got a good number of folks. Thank you to everyone who has joined. We will go ahead and get right into it. So starting with our Ambassador Policy Forum and Hill Day, one of our two major programs is the Ambassador Program, and that's our network of advocates. And at this point, I think we have about 120, more than 120 over across the whole country. And it's really just anyone passionate about advocating for sickle cell. So they would be sickle cell warriors, caregivers, advocates, providers, friends, anyone really who's passionate about it. And those individuals are able to attend an annual event we host called the Policy Forum. And that is paired with, for now, at least virtual Hill Day. I wanted to send a quick shout out to our sponsors who made this event possible. We were really thrilled with how this year's event went, and we could not have done it without your support. So thank you very much. And if you work at a company that's not listed here, and after this you might think you're interested in sponsoring, feel free to reach out. I have my email at the end of the presentation, and I'll connect you to the right person. So the Policy Forum and the Hill Day, it's our annual advocacy training event for individuals enrolled in the Ambassador Program. So it's not a public event, but we don't have requirements for the Ambassador Program. Really, anyone can join. So in that sense, it's not private either. And this is how we prep advocates every year to speak to their legislators. We let them know what our federal priorities are that we've worked on with other organizations and others in the community. And then this is their chance to take their story. Well, one of the chances they have to take their story and take the asks to the Hill. And so you'll see on the right sort of the summary of the agenda. So we had a keynote address, we had a session focused on state level policy, a session focused on federal policy, and then we always have some prep time to work on how to share your story, and we host sort of mock meetings in breakout groups so that folks can practice in a more intimate setting with folks other people who will be in their legislator meetings with them. So if you're interested in reading the full description and brochure, I linked it on our website. So I will be sending this PowerPoint out after. There are a lot of clickable links in here. So I feel like I clicked anything you could possibly want to know more about, but feel free to check it out on our website to get a full rundown of everything we talked about at the event. But in terms of speakers, we had really great speakers this year. One of our first speakers, the keynote address was Adam Taliaferro from Bristol Myers Squibb, and he spoke about sharing your story in an impactful way and illustrated it using his personal experience overcoming a traumatic spine injury, and then how to use your personal story to fuel your advocacy. Then in our state session, we had 3 different speakers. We had Dr. Fashipe, she's a physician out of Texas Children's Sickle Cell and Thalassemia Program. Lavelle Strong, he's one of our ambassadors and also the deputy campaign manager at People's Action. And he spoke a lot about grassroots organizing and what he's seen doing on the groundwork. And then Tracy Meeks, who works at Vertex Pharmaceuticals, was able to speak about state level policy issues that they've seen and they've been working on. So it was a really great group, really diverse in terms of what area they focused on. You know, we had the provider view taken care of by Dr. Fashipe. Lavelle took care of the community view. And then Tracy was able to speak about sort of the larger advocacy realm, including getting a little bit outside of the community. And then I spoke in the federal session along with John Otsuki, the government relations manager at SCDAA, and we really just ran through federal priorities for the year, some basic information about current sickle cell legislation. We talked about appropriation requests and recapped some of the materials that folks would be using in their meeting. And then Maggie was able to give a recap of how to use the platform for the event ahead of the virtual Hill Day. So I'll talk through the materials we use. They're kind of similar to what we've done in the past and just sort of an updated version of them. So all the way on the left, you see our FY23 one-pager. So this included all the information that advocates needed to know for the requests that we were making for FY23 for the government calendar, obviously. And it's separated into two main sections, which you can see. I know it's small, but you can get this on our website. The top section focused on a piece of legislation, the bottom section focused on appropriations. So this was an easy one-pager that they were able to leave behind. And then the other two further to the right are our toolkits. So we had one toolkit that outlined how to meet with your legislator virtually, you know, the things to keep in mind because it is different than meeting in person. And then another toolkit that we've had for a long time before, you know, since before we became an organization, about sharing your story. And it's sort of a worksheet that they can use to guide themselves as they're writing out their story if they're doing it for the first time, because it does have to be short, it does have to be concise, and some folks don't really know where to get started with that. And then you'll see in the top right, we did also include some Dear Colleague letters related to legislation. There was an American Society of Hematology one-pager we included. And then we also had a couple other toolkits and things that the ambassadors could use if they wanted. But getting into the successes of the Hill Day overall, a great success. These are kind of the high level numbers. We were able to achieve 72 meetings this year, and those were carried out by 53 advocates in 20 states. So the 72 meetings were as bipartisan as you could get, and you can see the breakdown between Senate and House was almost pretty even. And we actually did have 3 member level meetings with the actual representatives or senators in the meeting. And then the locations of these meetings were based on where ambassadors lived. So it was random in the sense that we did not choose the locations ahead of time, but it was based on whoever signed up and where they lived. So we were super thrilled because we basically doubled everything that we did last year, which was really exciting. And hopefully that happens next year as well. And I wanted to add a quick note, you'll see down at the bottom, really exciting updates. Some of the meetings we had, specifically these 4 with Senators Van Hollen and Klobuchar, and then Representatives Titus and Cleaver, actually said in the meetings that they were going to co-sign or co-sponsor some of the requests we were making, which was really excited. And this was specifically related to the Sickle Cell Disease Comprehensive Care Act. So that kind of wraps up the Hill Day Ambassador Policy Forum section. I encourage you to pop questions in the chat based on that if you have them. I'll give you a couple seconds before I move on to the next section. And I am doing, just a reminder, a very high level overview of this. There's more text on the slides than I'll go over, but you'll get the slides after and you can kind of comb through the details then. But I just wanted to guide you through all of the high level updates we have. So I'll go ahead and jump right into the Medicaid updates we have. So we have a couple different projects going in Medicaid, and I'll start with the advocacy work that we're doing in Medicaid, which is representation at drug utilization review board meetings, P&T committees, D&T committees. And to do all of this work, we activate our ambassador program. So individuals in the program or just others from our network of advocates, providers, and CBO partners across the country to get more representation for sickle cell in these meetings to really just create positive change, promote the patient voice in PDL decisions, and establish better relationships with the committees that are making this decision to ultimately increase access and, improve coverage for sickle cell therapies across the country. Our advocacy process is kind of a 5-step process, which is outlined on the timeline to the left. And then I'll just kind of walk through what we work with CBOs to do, because really what we want to do is let them know these meetings are happening if they have never participated before. And I will say that there are some states that have had really robust engagement from the sickle cell community for years now, but that's not the case across the country, and many people don't know these meetings are happening. So our purpose here is to really create that connection, raise awareness for these opportunities, and help them get comfortable presenting at them if they choose to do that. So we start by inviting folks to join our ambassador program, because that's where they get the most information about advocacy opportunities. And then, of course, we encourage them to attend the coverage decision committee meetings. But then talk about other ways you can get involved, such as writing letters to your state Medicaid director, trying to form a connection there, possibly requesting a meeting, applying for membership to local advisory committees or task forces, and then obviously doing other state level work with state legislators and the governor related to Medicaid, because it is so different state to state. So, sorry, I've got a little tickle in my throat. We'll go ahead and keep going. And just like we have recommendations for CBOs, we have done a lot of work, which I'll highlight when I show you a white paper, a recent white paper we produced. But we've done a lot of work just sort of gathering intel and listening to people's experiences in these meetings to develop best practices that we would see as improving the process or strengthening the process that already exists. So our recommendations for the state Medicaid programs, because it is important that we have increase on both sides. Our recommendations for state Medicaid programs would be to start performing outreach to community experts. There are a lot of task forces, a lot of advisory councils in different states who aren't necessarily utilized to their fullest extent. And nowhere does it say that Medicaid has to use these task forces or committees or councils, but it would really aid them in their decision-making, or that's, at least our view. So in addition to that, creating meaningful stakeholder engagement, not only with these expert groups, but also with local groups, local individuals, local policymakers. Part of the problem we see is that people aren't notified of these meetings. I've seen that some states, they have like an email list you can sign up when a new agenda is posted. But we would love to see disease-specific agenda announcements, just like you can sign up for a Google alert, being able to sign up for alert when your state Medicaid has your topic on the agenda. And then a couple other things just to help things run smoothly and lift the veil. So publishing guidance on providing input or public comments. Again, some states kind of do this, but it's really hard to know what is most helpful for them to hear, because so much of their discussion and so much of their decision-making happens behind closed doors in executive sessions. So that kind of leads me to 5 and 6, making sure that there are additional opportunities to connect and to engage and to partner, but then really promoting transparency and decision-making. Often we'll go to these meetings, local advocates will make their public comments, and then the committee will go into a closed executive session, and then they'll come back and make their recommendation, but we don't actually know what was impactful for them. We don't know what stuck with them, or to the same effect, we don't know what didn't really matter to them. So it's important to us to make sure that the warrior's story is out there and understood and part of the context in which these decisions are made. But we also need to know, is there specific data outside of clinical data that they would want to see? And what is it? Because currently we don't really know in many states, because they're not sharing what they need to make these decisions. And then here's a little recap of the meetings that we've had so far this year. So we've had 2, Florida and Oregon. Florida, we were able to coordinate comments from 1 advocate. Oregon, we did a lot of outreach to locals to let them know about the meeting. And then Texas is coming up in a couple days, and we have 2 advocates signed up to provide public comments. And I'll reiterate here that when they're providing public comments, they're not representing sick cells, they're representing either themselves or their local organization. So we just kind of hand off the information, help them feel comfortable, and then they do their thing. So some exciting updates. Florida, there was a sort of a positive recommendation, and their recommendation was to move Endari from non-preferred to preferred with auto prior authorization. They recommended to move Ciclos from a medical prior auth to an auto prior auth, which kind of opens up access. We're still waiting on the final decision. Oregon, still waiting on the recommendation, and Texas hasn't happened yet, so we don't quite know about that. All of this work that I just recapped, the involvement in the DERBs and working with advocates, this is all outlined extensively in our newest white paper, Advancing Stakeholder Engagement with Medicaid. That's on our website. I've linked it there. You'll find that link when I send this out. And then we also paired this with a blog that highlights 2 advocates, Shanice and James, and they were providing they provided public comments in the fall at a Wisconsin meeting. And the Wisconsin meeting was honestly kind of it was like the epitome of what we want to see. It went super well, and there were a lot of positive things that happened or came out of it. And so we really wanted to get their perspective so we could pair that with what we've seen. So I'd highly recommend, if you're interested in this sort of work, to read the white paper. Do read the blog. It's super interesting, and it's a really good companion to the white paper. So that wraps up sort of the advocacy portion of Medicaid. Again, pop your questions in the chat and I'll move through as many as possible, but I'll go full steam ahead to get into the research side of our Medicaid work. So this is a new project that we've launched, and I'm super excited to talk about it. Maggie Jalowski, our Director of Advocacy, is leading this. And so we'll have more information probably at a future policy debrief, but I'll outline the project so you have an idea of what it is. So for this project, it's a research project related to state Medicaid decisions and sickle cell. So to do this, we're working with Avalier Health to create this research and compile the data. And really what we're trying to do is just advance health policy and advocacy opportunities at the state level. And we're looking at improving state level policy for PDLs and Medicaid coverage, specifically for sickle cell treatment. And the goal of this effort would be to have enough information that it will shape not only our own policy work in this realm, but also we'll be able to share it with other organizations across the states so that they can implement it in their state, however they see fit and however is best for them. This is a pretty standard project in terms of breakdown. We've got 3 phases. We have an environmental scan, survey development, testing, prep, and survey administration, analysis, and reporting. So this is very standard stuff. We wrapped up the environmental scan in February. We did survey development, testing, and preparation in March. And then April is when actually all of this work, all the environmental scan and developing this survey, we're administering it to Medicaid directors from all 50 states and DC, basically asking them, what does coverage for SCD look like in your state? What do you take into account when you're making coverage decisions so that we can better understand the barriers to better work to address them? So a final report on all of this will include a summary of the data and then of the environmental scan. And all of this, like I said, it's looking at the 5 sickle cell disease treatments: Sicklos, Droxia, Endari, Adakveo, and Oxbryta. Part of the environmental scan is just a basic survey of how all of these drugs are covered in all the states, looking at where on this spectrum do they fall. Oh no, my little arrow got separated from his arc. Well, that's supposed to be just sort of in line. But we're looking at where they fall on this spectrum, going from completely unlisted or restricted access to unrestricted and open access, and everything in between. This has already helped us so much, and we're really excited to be able to share it in a couple months. So like I said, the final report will be made publicly available in June. And then Maggie will be producing a series of policy briefs that breaks down the findings from this into sort of more digestible pieces based on the phase. Very quick recap. Again, you'll have the slides. We have about 7 more minutes, so I am going to go ahead so we have time for questions. Just a really quick recap. This is sort of the collaborative work we're doing right now. We're involved in a few policy work groups, and Maggie and I are usually the ones to represent us in those. So we're working with Levitt Partners, Every Life Foundation Community Congress, and then the ASH Sickle Cell Disease Coalition. Each of those has their own subgroups, and some of them meet monthly or quarterly. You'll see some similarities between them in topics, and so it's really great to be able to have multiple sort of founts of information in sickle cell specific work, hematology specific work, and then rare disease specific work. And I think it really just helps us inform how we go about doing our advocacy. A brief note here, I won't spend too much time on this. I'll just encourage you to read over this slide when you get the slide deck, but this is a rundown of letters we've signed, comments we've submitted, and other things we've been involved in case you're interested in connecting with us about this. Most of these are available or at least outlined in our policy memos on the website, which takes me to the last section, publications and resources. So we have a couple new things we've released that are on our website, and I just want to make sure you all are aware of this. A couple reports. I know I already mentioned the Medicaid white paper, but we also released the proceedings report from last year's coverage of SCD, coverage for SCD Summit. That's on our website. Ashley also wrote a really great piece for the ISPOR magazine. You may have seen that on social media, but both of those are linked on our website. A reminder that we have lots of great resources on our website. We do publish monthly policy memos. We don't have a notification system for these, but if you sign up for our newsletter, you do get a notification for that. That's emailed to you every month, and that includes a link to the policy memo. There's a summary of the recent listening session we did at CMS with CMS rather in February. I encourage you to check that out if you're interested. We went there with a lot of other organizations. And again, the newsletter, that's where all of our updates are. And then we also have a tab on our website for media mentions. We've had a few really great ones recently. We're super thankful, including one New Yorker article with a quote from Ashley and just sort of more information about sick cells. And the last thing is to give you a heads up of a couple upcoming dates. So the next coverage for Sickle Cell Disease Summit will be hosting on August 31st. And then the dates for next year's Policy Forum and Hill Day in 2023. We did it, we got through it. If you have questions, feel free to reach out to me at my email there. You can also connect with us on social media. A lot of the things I highlighted here are on YouTube, kind of with a formal informational recording. So I encourage you to check that out. But for now, I will go ahead and stop sharing so I can see the group a little better. And I am happy to take questions. Let me see what we've got. Oh, Maggie was helpfully putting things in the chat, but go ahead and start typing out any questions you have. She put all the links to a lot of the things I mentioned. Thank you, Maggie.
Carolyn, if you want to come off mute, you can just go ahead and chime in.
Yeah.
Thank you so much. Do you mind putting back the slide deck? There was the two slides towards the end. Something about the support letter for Minnesota, and I wanted to see that again.
Yeah.
I had a question.
Let me pull it up. Oh, here we go.
Yes, letter of support for Sickle Cell Disease Foundation of Minnesota.
Mm-hmm.
Can you share with us what this particular one is about? And I'm actually curious. I wasn't aware of this particular letter of support.
Yep. So Ray from the Sickle Cell Foundation of Minnesota reached out to us because she was providing testimony at the state capitol for a bill. The numbers are listed there. And the bill limits the extent to which state agencies can take action against providers. And this is related to pain management and opioid dosage recommendations. And so really the bill is meant to give providers the power to make the decisions that are best for their patients. And that obviously is very important when we're talking about pain management for sickle cell in a clinical setting, especially when we see guidelines out there that kind of go against what is typically the best practice for the community. So Ray was advocating in support of this bill, and she asked if we could create a letter of support that she could take to the Capitol with her.
I think this is something that many of us in all of our states would like to do. What is your suggestion that because this is so important, and I would like to know more about how to be able to do this in our own state in California or something equivalent. What is your suggestion in terms of moving something like this forward?
I think that's a great question. Ray, since she was the one who was actually doing this, I'd be happy to put you in touch with her. I'm sure you have her contact information. I think part of it is making sure, there are a couple approaches. Part of it is making sure you have standing relationships in the state so that you know someone working in the House or state Senate who may be able to tell you if something relevant comes up. Another would be to sign up for alerts related to legislation. So I know I'm signed up for Google alerts for the federal level that anytime legislation mentions sickle cell disease or opioids or I have a couple other keywords, but I get an email about it and then I decide, is this important to us? Is this relevant? Yes or no? And that sort of dictates how we work. Off the top of my head, I'm not sure if this was something Ray was told about or approached for, or if this was something she went after. So again, she might be the best person to talk to about that, but the bill numbers are there. And so it's, it would be great if you're interested in doing this in your state to go find the bill, and then you can have that language as an example and tweak it however is best for California.
Thank you so much.
Hi, good morning. This is Lynetta Bronte Hall. I would like to make a comment related to that. I'm not sure what other states are doing, but in Florida, the law only requires that the physician uses non-acute pain. So it's called an acute pain exception. And when you write that, you can write for more than 3 days, of pain medication. So we haven't had any issues. All of our scripts go out as non-acute pain. We do have in Florida a House Bill 21, which is the legislation only for, it's the one that relates to prescriptions to treat acute pain using opioids. And so that one is where you have a limitation. But physicians who write non-acute pain, we haven't had that challenge. So I'm not sure what other states are doing, but that's how Florida operates with that.
That's super helpful. Thank you so much, Lynetta. I don't know if you are able to maybe put a link or just the number of the bill you mentioned so that maybe pop that in the chat so I can include that in the email in case others aren't interested.
Sure, no problem.
Thank you. All right, happy to take any other questions. Otherwise, the recording and the slide deck will be sent out within the next couple hours. Oh, perfect. Already in there. Thanks so much.
Mm-hmm.
All right. Go ahead. I can see everyone a little better. Okay. I think that is it. Thank you so much for coming, everyone. I know I get through a lot of information on these calls. I really appreciate your being here. Always happy to take questions. And even if I'm not the right person on the staff to answer them, I will connect you to the correct person. So always feel free to use me as a contact and I'll get you where you need to go. But I hope everyone has a great day. Feel free to send anything you think of later via email to me. I'll put that in the chat. And I'll talk to you all soon. Thank you. Bye.
Bye.
Thanks, Emma.
Thanks, Emma.
Thank you so much. You have a good day.